Hi, I'm Amber. Are you Gina?
Hi, Amber. Yes.
Hi, I have your patient in room 231.
Okay.
Would you mind giving me a quick estimate?
Sure. Um, Patient in 231 is Shanaina O'Connor. She is a female, age 34, weight 177 pounds, height of 5'9". She's a full code. Um, Brought in due to fever, chills, general malaise, and she has diabetes mellitus type 1, has stated that she's had diabetes since age 8. She is an end-stage renal disease and presented here from the emergency department at 0530 with fever, chills, and as I said, the general malaise. Patient reports elevated blood glucose readings and decreased appetite for the past few days and minimal urine output for the last month. History of renal failure secondary to diabetic neuropathy and hypertensive nephrosclerosis. She's been undergoing scheduled hemodialysis 3 times per week for about a year, and she was put on the transplant list about 6 months ago. Both parents are alive and in good health. Her allergies are trimethoprim and to sulfas and sorry about that, sulfamethoxazole, which causes rash. Um, let's see, she had a graft infection 3 months ago that was resolved after IV antibiotics, and she has a history of recurrent UTIs. No history of injuries or trauma, and has been placed on a renal diet with 1,500 milliliters daily fluid restriction. She is a high school math teacher. She hasn't worked since she started dialysis a year ago. She's married with one son, Henry, age 8, who is in good health. And she states that she has lost most of her friends since becoming ill, but she has one close friend that she sees weekly. So she may possibly could use some supportive services. She has a left forearm IV right now. Right forearm IV. Her current medications: calcium carbonate, renal multivitamin, aspirin, clonidine, aspart insulin subcutaneously with meals, glargine 8 units sub-Q at bedtime, erythropoietin 10,000 units that she gets with IV dialysis, and atorvastatin by mouth daily. So those are her current home medications. The fever is from unknown origin. Since she's had a lot of UTIs, we think that that could possibly be where it's coming from, but we need to get that for sure. Chest x-ray findings were normal. Urinalysis and urine culture have been ordered, and we just need to be aware of getting that collection. The blood was drawn for cultures in case of an emergency. Results are pending. Her vital signs are stable. Um, there is a plan to perform dialysis today due to her schedule. Nephrology has been consulted to provide dialysis orders, and the plan is to treat with IV ampicillin immediately after dialysis is run today, but we will review the cultures when they are available. Let's see. She's well groomed, well nourished, and she appears somewhat older than her stated age of 34. She's not in any acute distress, but she appears a little bit uncomfortable. Her integument system warm and intact, mild diaphoresis, no lesions are noted, functioning. Her AV graft appears clean, pink, and intact. Bruise and thrill present. Nail beds pink with capillary refill less than 4 seconds. Cardiovascular, she's a little tacky with a regular rhythm, S1 and S2 present. No murmurs or extra heart sounds. Slight 1+ non-pitting edema in her lower extremities. Femoral pulses 2+ bilaterally. 1+ pedal pulses in both feet with capillary refill less than 4 seconds. Her GI Her abdomen is soft, round, non-tender, no visible masses, no organomalgi. Sorry about that. Uh, Bowel sounds present in all quadrants. Normal range of motion in all joints. She does have strength within expected limits. Um, so her vital signs last were temperature of 100.9, BP of 138/78, heart rate of 108, respirations 20, O2 stats 97% on room air, and her blood glucose level at 545 this morning was 210. Um, she's orientated ×3, no masses or lesions on her head, her perla, auricles without lesions and tenderness on palpation. Tympanic membranes are clear and intact. Her nostrils are patent. The mucosa is moist without lesions. Gums are pink and firm. Buccal mucosa is pink without lesions. Chest expansion symmetric. All lobes clear to oscillation. No bladder distension. Her cranial nerves are grossly intact. Deep tendon reflexes are intact, and she does have sensation diminished in her lower legs. So we need to keep an eye on her if she needs to get up to just make sure she still has feeling in her lower legs. Her thyroid is not palpable, but we do need to get her started on this other medication, and that's what I'm going to be giving to her now.
Okay. Why specifically is the client receiving this medication?
The medication is an anti-infective. She has a fever, like we said, of an unknown origin, so they're giving her the antibiotic to hopefully relieve the infection and decrease her temperature.
And what action does the medication have on the body?
The medication will bind to the bacterial cell, to the cell wall, and it will kill it, and resulting in cell death.
Okay, when should you, sorry, excuse me, when should you question administering this medication?
If the patient has allergy to penicillins or cephalosporins, or if the patient has a history of seizures, if the patient has C. diff, there's a few different things like that. Also, with her end-stage renal, we would want to make sure that it's okay with the pharmacist.
Okay, does this medication have a therapeutic serum level?
No, not really.
Which vital signs must be monitored?
Well, since she has a temperature now, we want to get that temperature down, so we want to make sure we continue to take her temperature to make sure it comes down from that approximately 101 level. And since this is an antibiotic, you want to just basically monitor all the vital signs.
Okay, which physiological parameters should be monitored when the medication is being administered?
You want to monitor for anaphylaxis, which would be the most serious signs and symptoms. For rash, you want to monitor for any, it's in her IV, so you want to monitor for redness and itching, just the common things like that.
Okay, what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Well, you want to check the doctor's orders, but like I said, due to the end-stage renal and the diabetes and some of her histories, you want to check with the pharmacy, even with the doctor's order, just to make sure that everything is correct, and you want to talk to the people with dialysis as well.
Okay, what interventions must be taught for taking the medication safely at home?
Well, since this is IV, she won't be going home with this specific one, but we want to make sure she knows the side effects of any antibiotics, such as nausea, vomiting, diarrhea, those type of things, stomach problems.
And what are those side effects and potential adverse reactions?
The diarrhea, the nausea and vomiting, rash, the phlebitis at the IV site now, even as strong as seizures, C. diff, and anaphylaxis.
And how will you know the medication is effective?
Well, we will continue to monitor her vital signs. We'll look for the patient to show some signs of improvement with the decreased temp and not having any adverse effects of the medication.
Can I go with you while you give this to her?
Sure, we will check with her and make sure that's okay. All right. Hi. Hi, Shanina. My name is Gina, and I'm going to be your nurse for this shift. I have a nursing student, Amber, with me. Is it okay if she's here? Okay. If you don't mind, could I see your armband, and you could give me your name and birth date, please?
Shanina O'Connor, and I'm 34.
Okay, thank you. Now, do you have any allergies, Shanina? I saw on your chart, but do you know what those are?
Yeah, I'm allergic to sulfa drugs and trimethoprim.
Yeah, that. Do you know what happens if you have those medications?
Yeah, I get a rash.
A rash, okay. Yeah, well, we don't want you to get those rashes, so we will keep those in the system. But today, I know you came in here because you have a fever. We want to give you an antibiotic. We're going to give you imipenem. Have you heard of that, or do you know that you've taken that before?
I'm not sure.
Okay, well, that's an antibiotic, and we're going to try and get that to you through your IV so you get it quickly. And we're also going to give you some 0.9% sodium chloride, which helps to open up the vein and just helps everything go a little bit smooth. Now, there are some side effects to any antibiotic in general, but to this one, the imipenem, which is also Premaxim, you may have heard of it that way. You could possibly have nausea and vomiting, maybe some rash at your IV sites, heat, itching, and diarrhea, things like that. I will leave like a basin here just in case you do start to feel sick, and have your call light nearby just in case you start to feel sick. And I know you're having some tingling in your legs, possibly neuropathy type things going on. So if you do need to get up to go to the restroom, make sure you hit the call button, and we will get here as soon as possible. But that's why I will leave the basin. Okay. All right. So I'm going to check your IV site. How is it feeling so far? Is it okay?
Feels fine.
Okay, it's looking a little green. It's not warm to the touch or itchy or anything like that?
Nope.
Okay, seems to be clear. Okay, I'm going to need to flush that.
Okay.
Get some alcohol here. And we use the alcohol. We want to make sure, since this has been out like this, we want to make sure we wipe it down for 15 seconds because we do not want to contaminate you in any way, which I'm sure you appreciate. Okay. We do that for 15 seconds, and we are going to flush. Now let me make sure the clamp is off. Okay. And I would inject all of this flush, which I'm doing. And I'm just going to leave that there just so we don't recontaminate it. It's empty, so if you don't mind, I'll connect the IV tube to it in just a second. So have you had any visitors? Has your son been able to come see you yet?
He's in school right now.
Oh, that's true, that's true. Okay. So I have the 0.9% sodium chloride. I would take the bag out and check the clarity. I would check the amount, check the expiration date, 10/2017, make sure there's nothing floating in there, and also squeeze a little bit to make sure there's no holes or punctures in the bag at all. I want to check that with the MAR. Okay, and I see that this is going to be continuous, and you'll get this every 8 hours. And we're going to do 30 milliliters per hour. So I'm going to label. I'm going to label this with my initials, so the person that comes on next knows what happened, or knows who did this. I'm also going to be labeling the tube, and that will let you know, or let the nurses know when it needs to be changed, and that's every 4 days. We will list the day that it needs changed on here with my initials as well. Okay. Now we want to maintain the sterility of the spike, and we are going to stick that in the bag. And you have to be careful because the spike is pretty sharp and it can puncture the bag, or it could even puncture through the glove and into your finger. We need to prime the tubing. I'm going to hang this. And immediately I want to make sure it's clamped. It is. It's labeled.
She has a history of renal failure secondary to diabetic neuropathy and hypertensive nephrosclerosis. She has been undergoing scheduled regular hemodialysis 3 times per week for about a year. She is listed for transplant 6 months ago. She also has a history of recurrent urinary tract infections. I did assess her. She is awake 11 times 3 Florida. She is tachycardic with regular rhythm. I heard S1 and S2. No murmurs or extra heart sounds. She does have a slight 1+ non-paid edema.
We want to make sure that we get all of the air bubbles out.
Her chest expansion is symmetric. Our lobes are clear to auscultation. She reports frequency of urination and volume of urine. Urine has recently become more concentrated in doctor's power. However, she denies any pain, burning, or difficulty in urination. I didn't notice any bladder distension. She's warm, intact, mild diaphoresis. She has a functioning 80s graft on her left forearm and 18 gauge for her right arm.
You don't want to waste too much of that.
Her last blood time is taken at 0730.
This is
blood glucose levels
ready to be put in.
100.9. Her blood pressure 138/78.
I'm going to go ahead and clamp the IV
level is a 4 from a scale of 0 to 10.
on your arm.
She is on a renal disease diet. For complete blood count and differential
And I'm going to undo the flush, which is what was keeping everything sterile, and insert the IV line. Nothing will be going in at this time.
I recommend that we call the doctor to report elevated glucose level, as I haven't seen the insulin prescribed in the EMR I will continue to check further results with her lab results.
So nothing's going in right now.
Dr.
The
Akbar
IV
has
line is
ordered
connected.
some sodium chloride 0.9% normal saline, and we need to run that 31 days continuously. And imipenem, cilastatin, which is we piggyback at 500
All right.
we will be
So I
giving
have
100
the
ml per hour.
sodium
So,
chloride
so
ready.
any questions?
Yeah, just a few. Why specifically is this previously this medication?
So her urinalysis did come back for an elevated weight.
Okay, could I scan your armband, please, hon? And what was your name and birth date again?
Shanina O'Connor, 34 years old.
Okay.
The medication will bind to bacterial cell wall.
Thank you.
When should you question administering this medication?
If she were taking any other
And we want to scan the barcode.
medication has interaction with other antibiotics causing
Does this medication have a therapeutic serum?
And we want to list that it's the right forearm.
Which vital sign was being monitored?
I would monitor all vital signs, however, I want to pay close attention to blood pressure,
And the time.
hypertension, as well as if she has
Which physiological parameters should be monitored when the medication is being
Started at
I would monitor her for her
6:30.
What interventions must be taught to the client to ensure the medication is administered safely in a hospital setting?
So I want to make sure the patient knows that she has full rights to use my medication, and also the medication doesn't have any drug-to-drug interaction, and if she has any allergies to medication.
What interventions must be taught for taking the medication safely at home?
Medication is usually given at the hospital, however, if she wants to take it home, tablet form. So I would probably suggest to her to use the disposable exactly as the message. Medication is given the right details, and do not take them often than what is prescribed.
Okay. What are the side effects and potential adverse reactions?
So I would teach her about seizures as well as anxiety. She has certain
That's all my questions for you.
I didn't do any of that. You're telling me to pick everything. That's what I did. I didn't do the second bit.
Okay. So we have this ready to set up. We're going to turn on the machine.
Mia Minnie, she's a student nurse, and she'll be here as well.
And we have a section here that goes into the machine. It's a little bit more easy to maneuver.
I'm gonna have you verify your first and last name for me, please.
Okay. New patient, yes. Med surge, yes.
So Miss O'Connor, I'm seeing that you have
I need to get your armband again.
metrazole,
Thank you.
Lexazole,
If you don't mind holding that there for a second.
and this causes a rash, right?
4.
Do you have any other allergies that I should be aware of?
They need to get this where it's scannable.
Do you have any pain?
3660, thank you.
So the doctor has prescribed you an antibiotic for you and imipenem, because your analysis has come back with an elevated
Okay, great.
So it shows this causes
So we want to make sure this is in the first channel. Channel select. Guardrails IV fluids.
So some side effects that I want you to
I think you're supposed to press the other side.
Oh, you're right. Sorry about that. The 0.9 saline. Correct. The rate.
Alright, so I'm gonna go ahead and get started. So first I did check the IV compatibility, the white side for these two medications, so we'll get to
30
that there.
milliliters an hour.
So I'm gonna scan the patient's arm. So Ms. O'Connor, can you have me verify your first and last name again and date of birth? So first I am going to hang our 0.9 normal saline, 0.9% normal saline. gonna check the bag for any leakage, expiration date,
For 8
correct,
hours?
medication. The dosage is going to be 30 ml per hour, and that's going to be continuously. Okay. So once I have her idea, I'll go ahead and scan the medication. Also, I'm checking for the clarity of the bag, and it looks fine there.
Oh, the milliliters. Sorry about that. It's 500, so we will put 450.
So now I'm going to scan the bag. First, we want to make sure our line is locked.
Okay, we want it at 30 milliliters an hour. Okay. And then secondary. So we come back over to the piggyback that we're going to put in. And this is the imipenem or Premaxin. And it's going to beep on me if it takes me too long. So I'm going to put,
I want to make sure there are no air bubbles.
okay. And yes, that's what we want to give. 500. And the rate. The rate was.
My line is good. Go ahead and put this into the IV trunk.
Over 60 minutes. Okay. All right, so we want to verify the medication.
So now I'm going to check the kind of your IV site, and I'm going to flush it before I connect the bone saline. Okay,
And again, I'm going to need your armband.
so
And what is your name again?
Selena O'Connor, 34.
Thank you. And we have the piggyback that we are going to administer. We want to clamp it and label it.
Gina, do you need some help with the pump for a second?
Sure. It's not hooked up yet, so we need to pause it. Right? Okay. All right, so we will make sure that this is clear and that there's nothing in the bag. And we are putting the tape on it for, we won't need to know because it's only going to run for a little while. But it needs to be changed, but the tubing can be reused for 4 days. So we need the piggyback to be higher than the saline.
now I'm going to set my pump here.
Oh. There we go. Okay. And again, we would put the spike into the bag
I'm in the bed surge.
to keep it sterile. And we
I'm going to
would
do a cocktail IV therapy.
use alcohol.
It is my 0.9%.
Since this tube may have been used prior, we want to make sure that it's clean as well, and wipe that down for 15 seconds.
ml per hour.
Going to connect
Volume to the infused.
the closest port,
I'm going to run at 450 ml because I don't want
leave
to
it clamped,
run dry.
and we're going to hang the piggyback up higher,
I'm gonna go
and
ahead
we are
and
going to
start
prime
it,
the
and
tube.
pump is going to check the line. While it does that, I'm going to
Going
clamp
to
this. So we can
undo
check the line.
the clamp in just one
While I
second.
check that,
We checked everything on the med, so we're going to scan it.
so it's occluded somewhere, so I have to release it. I'm going to release that. So it's green, so it's good there. So now I'm going to document that the sodium chloride, and then we'll start on the other medication.
Okay.
So now I'm going to verify my second, the imipenem, so statin. So I'm checking the medication against my MAR. So the right
Get this to
name,
save.
time, the dose is going to be 500 mg, but we are going to run it 100 ml per hour.
There we go.
No expiration date on this bag, no leakage. Clarity is good on the medication.
All right, so we had paused it. So now we're restarting. And I want to open up that clamp. And we wait and watch for 5 drips before leaving.
Do you remember the 2 side effects that I mentioned? Perfect. So I also printed out this information regarding the antibiotics. If you have any questions,
Okay.
you can let me know.
So everything is open and running. So it will be running for you for the next few hours, and we will keep checking on you, okay? Now, do you remember what I mentioned earlier that you need to kind of keep an eye out for? Okay. I do have some paperwork on antibiotics. I also have a video on our new TV system. You can watch a video on antibiotics and what to do, things to look out for, okay? So I'll give you that. I have the call light here for you. And we will be back to check on you, okay?
Okay.
If you need anything, just let us know. Thank you, and thank you for letting the student come in.
Thank you for showing me that.
Sure.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Well, I checked the order from the doctor. I checked the med, the time, the route of the medication, made sure it was the proper patient, the expiration date, the color, clarification of the medication, and the patient vitals. had to make sure that that the bag was okay of medication, but then we also needed to review with the pharmacist and make sure it was okay with her other conditions.
And did this information affect your decision to administer this medication?
It did. You always want to double check your order and make sure you have all the correct information so you don't make any med errors and put anyone at risk.
Right, and one last question. Did the information affect how you administered this medication?
Well, yes, because she's got a fever at this time. She could have a UTI going on that we want to get cleared up. That's why we're giving her the antibiotic IV. And we verified that that was going to be okay. So,
All right, thank you so much for showing me today.
thank you. I appreciate you coming.